But it is 1 o'clock, so we're going to start now. And so please turn yourself onto mute and turn your camera off. And first of all, and it's many of the staff at the DSA, and we're going to be talking about what we've been seeing happening in the last 2 weeks, and you can ask us questions about anything happening before, anything you want to know. And it takes a little moment to operate. This is what we're going to do. We're going to set the scene with Carol, and then we're going to show Sam's film explaining some things, and then a quick recap on last week's webinar when we looked at supported decision making, then the picture across nations, and then an update from our helpline and reminder about what's happening with hospital admissions and visions and health. And then what we're doing for people who have Down syndrome with an Our Voice update, and then an update about our employment program, Workfit, and then questions, and then we'll finish off with another film from Sam, talking about his experience as a shielded person, because he's been shielding since March. Okay, over to you, Carol.
Thank you, Jill. Hello, everybody, and welcome to the third webinar in our series of updates since people who have Down syndrome have been added to the clinically extremely vulnerable list. As Jill says, this afternoon we've got several members of the DSA team who'll be bringing you all the latest information that we have on how the CEV classification is affecting the lives of people with Down syndrome. And we've got quite a few examples of decisions that individuals have made based on what they feel is their own particular risk from COVID-19. The DSA has been told by government that the current advice to people who have Down syndrome will change at the end of the lockdown on the 2nd of December. But currently we have no idea what those changes might be. And of course, we'll be trying to get information as quickly as we can. I think we should remember that over the last 50 years, the DSA has fought really hard to remove the stigma of what we call the medical model of Down syndrome. And the achievements of people who have the condition today are a testament to that, with the amazing things that people with Down syndrome are now doing. And whilst we want to keep people safe, we don't want to see those hard-won opportunities eroded by a mass medical classification of people who have Down syndrome. So we will be talking to government about that and making sure that any decisions that are made are based on solid evidence. So I'm now going to hand over to Jill, who's going to take us through the presentations today. Thank you, Jill.
Thank you.
Hi, my name is Sam, and I am a member of the Down Syndrome Association, our Voice Committee. If you have Down syndrome, I want to talk to you. Every adult who has Down syndrome is being put onto the clinical extremely vulnerable list. What does clinical extremely vulnerable mean? This means you are more likely to be very ill if you get coronavirus. You will need to find out about staying safe. The Down Syndrome Association has some easy read information to help you on our website. You shall get a flu injection which will help you to stay well over the winter. You can talk with your doctor about other injections and things that will help you keep well. You can still live your life, but you need to check that you are safe. Remember, the Down Syndrome Association is here to help you. If you want to meet other people who have Down syndrome and talk about things, you can join the R4 community.
Thank you, Sam. Now we're running through what we went into detail in last week's session. So just a few summary points from that, which are really about people's rights, their human rights to make decisions. And we talked about the Mental Capacity Act, that for people to make decisions, they need to understand the information and remember it for long enough to be able to think about the information and to be able to communicate their decision. And that the law says that people should always assume we have the capacity to make a decision, and that each decision is different, so should be looked at separately. If we cannot make a decision, the people who support us, or sometimes a professional, must make a best interest decision for us, and that would include consulting on the views of families, members, and people who know us well. But emphasizing that is what is best for us, not best for someone else. And that we aren't restricting anybody's rights or breaking the law in the where we make decisions for people. I've put in the links to important information and downloads on our website and more detailed information for making decisions. And then last week we went through a quick guide we've made to help people be supported to make decisions, and we went through some real examples going step by step with that decision making quick guide. We also have just in the past few weeks made these 3 resources. One of them is the quick guide, the other one is staying well and healthy, and the other one is staying safe, and they have some good clear information in them, so do have a look at those or download those to use. Now I'm going to hand to Julian to speak about what's happening across the nations.
Okay, thank you, Jill. I'm Julian and I work in Jill's team. Clearly, I think, as an organisation that covers England, Wales and Northern Ireland, we want to make sure that we're providing information that's of relevance to all of the families that we support. And the key message is that the advice about adults who have Down syndrome being added to the clinically extremely vulnerable list is an all UK decision. So all of the chief medical officers from the respective nations have decided that together. Slightly frustratingly, the means of communicating the information does differ depending on where in the UK that you live. So people may know that, we're getting used to this in terms of the picture regarding sort of management of coronavirus does differ depending on where you live. So in Wales, came out of a national lockdown on Monday. England are now in the midst of our national lockdown. My understanding is Northern Ireland has been in lockdown, but have now recently come out of that. So the situation as far as England is concerned, letters have been sent to all GP practices asking them to identify the adults that they know of on their patient list, and the GPs have letters, so easy read letters and letters to family carers and support staff that they will then generate, and they will send those letters out. And we know from some of the contact we've had through our helpline that a number of families have already been receiving those letters and have had individual telephone conversations, and others haven't as yet. So I think our message would be GP should be aware. This went out about 10 days ago. If you haven't had contact in the next week, probably need to follow that up. The situation in Wales and Northern Ireland is slightly different. So letters are being sent out centrally from public health teams. And we've just literally had copies of the letters that are going out in Wales in about the last half an hour. And the news on that is those letters are going to be sent out from next Tuesday onwards. So families living in Wales should be getting those letters imminently. And we have also been aware that letters are going out in Northern Ireland. So if we could move on to the next slide, please. I think, as Carol started by saying, we've moved significantly away from a sort of medical model of thinking about Down syndrome. And what we know in terms of the individual health profiles for people with Down syndrome, they will differ very greatly. So the status of the addition to the clinically extremely vulnerable list is guidance. It's not mandatory. It's not one size fits all. And what individuals and their families are being encouraged to do is enter into a discussion with somebody. As the Down Syndrome Association, we can't, through our helpline, provide you with individualized advice about your situation, because obviously we don't have information about your individual medical histories, but we would encourage people to make contact with their GPs to do that. So if we move on to the next slide. One of the things that we are well aware of, and we have fed this back to relevant teams at the Department of Health and Social Care and NHS England, is that the GP register, so there's a coding that relates to an individual having Down syndrome. And we know that that isn't complete. So there will be some adults with Down syndrome who won't necessarily show up on that list. And it's why we're doing a lot to make sure that we're getting information out. We're being proactive in emailing families that we have contacts for, and also we'll be sending letters to relevant families on our membership list. We've also been busy on social media, on our website, to make sure that all of those families that need to be aware about this new addition onto the clinically extremely vulnerable list get that information. And when my colleagues in a moment are going to talk about the experience we've had on our helpline over the last fortnight, we know that the reaction to the news has been very mixed. Some families feel quite relieved that adults that they support are now recognised as perhaps needing extra support and extra vigilance. And this is sometimes an extension of what people have been doing over the last couple of months anyway. Other people have been very anxious. And I think it's about trying to put this into context and give reassurance and good quality information so that people can make the decisions that are right for them. As I said, saying that there's no one size fits all. What we do know, and this is something, if many of you might have attended the webinar that we hosted this morning, and that will be available on our YouTube channel shortly. There has been a distinction about how this information, or the research demonstrates that the clinical vulnerability needs to apply to adults only and not to children that have Down syndrome. And that's something that obviously we've had a lot of questions about over the last couple of weeks. And then the next slide. So the experience to date, and in some ways it's amazing that it is only a fortnight, it seems longer ago than that. We are aware that some families have been receiving really good support from GPs. So GPs have been proactive, they've rung families, they've had an informed discussion involving the adult with Down syndrome and their family carers, and have come to an arrangement over what advice they need to give that's right for that particular individual. Also, we've been told by some families that their GPs are not yet aware. So, we know that people working in primary care are very overloaded at the moment. So it might be that that letter hasn't filtered through to the relevant partners at the practice, but certainly follow up on that because they have all been contacted. Unfortunately, some families have been told their GP is just referring people back to government websites. So when they've asked for some individual advice about their adult son or daughter, they're not being given that advice. And we raised this at a meeting that we went to with Department of Health and Social Care earlier in the week. And the advice that we were given was to push back on that. So if you've been told that by your GP, you know, feel confident that actually the advice from the directors of primary care at the Department of Health have been to GPs to make themselves available to provide that individualised advice. And then I think there's one final slide for me to speak to. No, I'm now going to hand over, I think, to my colleagues in the helpline.
Yeah, over to Jane.
Hello. Yeah, so we've got, I think it's 3 slides we've got to go through here.
Yeah.
As you can see, we've been receiving calls from a range of people with regards to adults having been added to that critically extremely vulnerable list. There has been a mixed response. Some feel that it's a good thing that the health issues are being recognised, and quite a number of those callers are asking then how to get letters from the GPs to actually confirm that they've to shield and not to attend either work or college. And then others are saying that they're unhappy and feel that there's been a level of discrimination. And that's not discrimination, the fact that they've been put onto that list. It's more to do with the way in which that news and the guidance has been interpreted by local authorities and providers. There has been a lot of confusion and questions about why there's that cut-off age at 18. And this can be explained to a certain extent by the fact that the numbers for children who have Down syndrome and have been hospitalised has been quite low. So there hasn't been actually enough data to analyse that. Okay, next slide, please. Yep, parents have been concerned that their loved ones will be suffering emotionally if they're not being allowed to attend college or work or day opportunities. And what we're doing is encouraging families to share our information with those providers, work together and try and make informed decisions about attending rather than accepting a blanket decision for all adults just because they have Down syndrome. The guidance is that what will happen after the 2nd December, that this is only for lockdown, but our loved ones will remain on that list. But the guidance about not attending college, etc., that's is only for lockdown. With regards to being on the top priority for the vaccines, we've received quite a few calls about that. And at this stage, we really can't give any advice because we don't have enough information, and that priority list might actually change when it comes to rolling out the vaccine. Okay, next slide.
Okay, thank you.
Okay. We've already mentioned that things have been interpreted in different ways. We are encouraging callers to signpost providers and GPs to the DSA website for information and resources. I don't know if any of my colleagues want to add anything to that on the helpline. No.
You're very welcome to.
Okay.
Stuart, I don't know if you want to add anything. I mean, we haven't just had a few calls, we've been inundated.
Yeah.
The helpline has never been as busy, so apologies to anybody who's had to wait for a call back, but no, the response has been huge, enormous, and obviously very concerning, very, very concerning. People not really knowing what they're supposed to be doing and certainly being misinformed from other sources about what they should be doing. Okay, and you see the bit at the bottom, this was the past day or so, we had quite a few calls where schools, colleges have been asking for GP letters to allow attendance, and the GPs have been charging £40 for writing letters. I mean, quite unbelievable, really. And we can come back to more of that in the questions and answers, but I'll now pass on to Stuart, who's going to remind you about what happens when you visit hospitals and looking after your health.
Thanks, Jill. Hi, I'm Stuart and I'm an information officer and come within Jill's team. The picture is of a resource that we put together at the start of the pandemic, and it's really just about being prepared for hospital admissions, the things that you can actually sort of put in place beforehand. So we would really sort of strongly suggest that everybody has a hospital passport or an all about me resource ready for their loved one in case there is need of an emergency hospital. And this really contains very important information about the person, their health, their means of communication, allergies, etc., that would all be useful if there is an emergency admission to hospital. I would also say, make a family emergency plan so that you know how you're going to react as a family and support one another when the hospital admission takes place. And just to be aware that many hospitals will have a learning disability liaison nurse attached to the hospital, and therefore if your loved one is admitted to hospital, try and contact the learning disability liaison nurse if there is one. And finally, just be aware of reasonable adjustments in healthcare. That in any healthcare setting, health professionals should be making reasonable adjustments to ensure that your loved one has equality of access to and timely access to good healthcare in the same way that anyone in the population has. Next slide, please. So an important point, and one that raised a lot of sort of worry and consternation at the start of the pandemic. So if your loved one has to go into hospital for any reason, that you as a family member or carer can visit or accompany your loved one or the person you support. If not being present would actually cause them to be distressed. So that's a really important piece of information to sort of retain and store away. Next slide, please. So just to flag up that we have produced a couple of accessible resources, and in this context of health, one is staying well and healthy. And some particular important points that contains is that everybody should ensure that they have a flu vaccination. Now, a more general point, people with Down syndrome should be offered all immunisations that are on the national immunisation schedule, as a matter of course. And flu vaccines should be available from the age of 6 months and thereon on a yearly basis to people who have Down syndrome. There is more information about immunisation on DSA's website. I think there's quite a comprehensive journal article there. And also, if you have a loved one who's aged from birth to 18, the PCHR insert has information about vaccinations. Another quick point about vaccinations is that the pneumococcal vaccine should be considered for anyone over the age of 2. Now, this doesn't happen as a matter of course, so we would advise a discussion with your family GP practice about the pneumococcal vaccine for your loved one. And a really important point that we'd like to stress that, in these difficult times, it is vital that your loved one continues to access healthcare as and when they need it, and that they attend planned appointments, for their sort of healthcare. Next slide, please. Oh, sorry, I missed out the point about vitamin D that was included in that last resource, which I'll just quickly mention. And this was raised in the webinar earlier today. that it is advisable to take vitamin D. I think the health professional that spoke at our earlier webinar mentioned that the dosage was 1,000 units. Advised that you take a look at the NHS website, which has information about taking vitamin D, where you'll find information about the dose for children under 1, and then the dosage for the rest of the age groups. And the advice is to talk to your pharmacist about what form of vitamin D suits the person who you support. Next slide, please. I would also sort of make the point that if you are a person who is aged over 14 with Down syndrome, that you are entitled to an annual health check from your GP. So please continue to access annual health check as well. At this time, it is very important that you do so. I just thought I'd like to sort of flag up this resource in relation to children, which was put together by a consultant, Elizabeth Herry-Evan, who also happens to be a mother. So I think it's just very useful to be aware of this top 10 tips for triaging and treating kids, and to maybe have a copy to hand and flag it up to health professionals if you are in a situation where it might be needed and useful. Next slide, please. Okay, and just to make you aware, we do have a lot of health information on our website. We have the DSA Health series of publications, which was co-produced with the Down Syndrome Medical Interest Group. If you have any sort of health inquiries, I mean, please give us a call, that I and my colleagues in the information team will try and help, although we're not health professionals. If you have an inquiry that we are unable to sort of answer, we will then go to our medical advisors who may be able to sort of help. I would stress, however, that any advice they give will be general, and that they cannot answer sort of questions about your specific circumstances, and they can't comment on individual test results. Thanks very much.
Thank you. Now I'd like to introduce Robin to talk about the work that the work that people with Down syndrome are directly helping us with, really, and how we're adjusting that for the coming months.
Yeah. So my name is Robin. I'm the Inclusive Participation Officer and also work on Jill's team. So I'm just going to talk to you a bit about the Our Voice community and some upcoming online activities that DSA have organised. So to start off with, the Our Voice community is a community of people who have Down syndrome. For many years, the Down Syndrome Association has run groups with people with Down syndrome, but at the beginning of this year, they all consolidated into one kind of program, which is now under the name Our Voice. And the group is growing actually quite quickly at the moment, and we're getting lots of people join the group and talking with each other and thinking about what it means to have Down syndrome. Yeah, it's going really well. So because it's growing, we're starting to think about what other things we should be doing and exactly how the group wants it to run. Things the group do is create change. They have helped us in lots of webinars and training. Below that is helping other people who have got Down syndrome, and they've helped us with most of our, well, I think all of our Easy Read resources this year. They've advised us on lots of bits of work and our communication, and they've been really good at telling us what they think and directions that we should be going in. The group currently, we have a Zoom call which meet up once a week, but we also do work outside of that, including focus groups. We've got an event on Tuesday which I'll explain a bit more about, and the group have got lots of ideas for upcoming activities. that they would like to run. So I suppose in essence, everyone's keeping in contact and having an opportunity to be heard, having an opportunity to talk about how things are for them. If we could go to the next slide. So on Tuesday, we have a launch event for DSA Engage. This is a new program of online activities that are going to be presented by DSA staff, but also by people who have Down syndrome as things develop. So on Tuesday at 4 p.m, myself, some of our team, and about 3 or 4 members from the Our Voice community will be launching these activities. It's going to include yoga, fitness challenges, dance, arts and crafts, and lots of things just to kind of stay busy. And as obviously as the restrictions have carried on, we want to make sure that people have got stuff to engage with and keep active at home. So yeah, if you would like to come on Tuesday, there's a link in the handout from today, which will direct you to the sign up page, or you can just Google DSA Engage launch event. That will take you to our website. Thank you. Okay. Oh yeah, and sorry, the final thing is we would like for you to tell us what you would like Down Syndrome Association to be organising. We have put together a programme of activities which will currently cover an evening from Monday to Friday. But obviously we want to make sure that we're organising activities that people want and will be beneficial, and yeah, just be focusing on things that people maybe are missing due to the restrictions. So if you have any ideas of things you'd like us to organise, or maybe if you're a person with Down syndrome and you have got an activity that you would like to run for us, we can help you make that happen. So you might want to run a craft workshop or something over Zoom. Any ideas you have, please come on Tuesday, and we'll be making a big list and thinking about how we can make it happen.
Thank you.
Thank you, Jill.
And now I'd like to introduce Alison, who's going to tell you about the work of Workfit. Very relevant for what's happened in the last 2 weeks. Over to you, Alison.
Thank you, Jill. Hi, everyone. My name is Alison and I manage the Workfit programme, and myself and my colleagues in the Workfit team are part of Jill's team. We're conscious that we wanted to give an update on Workfit and just let you know that we are here to help you. Many people are having to make decisions about work based on the latest advice that we've received. Can we have the next slide, please, Jill? So we all know about the benefits of going to work and how valuable it is and how important it is to all of us to have our jobs. And, you know, mental health is a thing that we're hearing a lot about from our people at work and families. We know how good it feels to be out there earning our own money and being confident about what we do. So this latest announcement has caused a lot of different emotions in lots of different people. Next slide, please, Jill. These are some of the things that we've had in terms of feedback from some of our members. Some people are anxious, some people are frustrated because they really want to go to work. Some people are very determined that they will go back to work. Some people are very proud that they've actually been able to continue to work throughout the first and second lockdown, and very proud of themselves, and rightly so. Some families are more concerned than actual individuals about going to work. So it's a very mixed bag in terms of how people feel and how confident they are in the whole situation. Okay, next slide, please, Jill. So what Workfit is here to do is to help you in terms of the choices that you can make about work. We know that many people are currently furloughed, and some have been told that they will be furloughed from work until the end of March. Other people are in different situations. Sadly, some people haven't been able to continue in their jobs and some people have been made redundant. But we just wanted to let you know that we are here to help you with all of those discussions that you might want to have. And we've just listed a few key things here that you might want to do, starting with talking to your doctor about your individual situation, because we know that everybody's an individual. We all have different health conditions and things that we need to consider, as well as being able to travel to work safely. Also, we've all had to get used to new ways of working around wearing masks and hand washing and being distant, and some employees have put in one-way systems. So there are lots of new things that we need to be confident that we can get to grips with and understand. And also, it's very important that we talk to someone who can help us and talk about how we feel about our jobs and what we want. It's very important that voices are heard around what people want to do. Next slide, please, Jill. And just on that, just a slide about decisions. I know we've on recent webinars, we've talked quite a lot about decision making, and it is very important. Just to recap here around decisions about work, every individual is different and every workplace is different. So there are lots of discussions to be had with employers about what might be appropriate for people going back to work. I'll just give you an example of a young lady who started work about 6 weeks ago in a paid job and that she absolutely loves. I'm just going to call her Sally for the purposes of this discussion. When the guidance came out, her employer was quite concerned, understandably, and wanted to make sure that she was safe at work. And we've had some very constructive discussions with that employer and their health and safety representative, line manager, and Sally and her family. And she is continuing at work very successfully based on her expressing her wish to continue and the employer being able to put a few more things in place to make her even safer than she was before. So fortunately, people are able to continue in work, and we know how important it is for them to make that decision and feel empowered to make a decision when they have the information that they need to do so. Next slide, please, Jill. This is just a table of some of the key things that you might want to think about in terms of going to work or going back to work or going out into the world of work for the first time, potentially. There is a recording available of today's slides and everything, so don't feel that you need to try and capture everything on here. But these are just things that I've already mentioned: talking to your GP, traveling to work, understanding the risks, understanding the consequences, and just being able to talk to people about how you feel and what you want to do. That's very important. As we know, employers are usually pretty good at assessing risk, and they might do some additional risk assessments with you about going back to work, and that will all help with them making sure that they have the right measures in place to try and keep you safe. Next slide, please, Jill. We've got a toolkit for candidates and families on the Workfit website. And again, the links will be provided for this. And this just expands on the kinds of things that you want to think about when making decisions about work. There's lots of easy read information on there, which hopefully you'll find quite useful. But we know that it's very important for people to continue to engage in things that they enjoy, and we know how much people value their jobs. So we just want to do everything that we can to support you in your career ambitions. Some of you will know many of the team. They're on this call today. So we've got Simon, Paul, Becky, Molly and John, who are with me in the Workfit team. Please feel free to contact them if you already have been working with them, or feel free to contact me if there's anything at all that we can help you with. We're very happy to help. And Jill has a slide, I think, for our contact details, which is the next one. So please feel free to get in touch with us if there's anything that we can help you with, if you haven't done so already. Okay, thanks, Jill.
Oh, thank you very much, Alison. Now we are moving over to questions, and we may not be able to respond to all of them today, but we do have 20 minutes left, so that's good. But you can email inquiries to our info@ address, which is where things will come through to our helpline. You can also follow our news, our latest news, either under the coronavirus section or on the main website page, because that's where we'll be telling people about new events and recordings and what the latest we're hearing from government, or any views on anything at all. For example, there was a new report that came out yesterday, which we'll be making a statement on the leader report. So do follow the news. Now I'm going to ask Robin to ask the team, all of our staff, the questions that are appearing in the chat.
So thank you very much, Jill. So what I'm going to do is try and look for some recurring themes and questions. So hopefully we'll manage to cover most topics. One thing I just wanted to mention, I saw some questions to me as I was speaking earlier. One thing I probably didn't make clear enough is that we are very open to new members of Our Voice, and we kind of have open arms for anyone who has Down syndrome. The only requirement for joining is that you are over 13 years old, and if you're not over 13, you can still engage with the group, but you just need to have support with you. So that could be a parent. But yes, we're very open to having new people, and I'll put the sign up link in the chat in a moment. So the first question is around children and shielding, and a parent asking if children should be shielding. So I think I'll just pass that one straight back to you, Jill, if that's okay.
Okay. Only if your GP says you should be, and that would be on account of a very serious additional health need, probably like chemotherapy or something like that. I expect you know that many children were removed from the list who were on it last time, and if you've been following the evidence from T21RS or from the BMJ article, that says that children should be at school unless they're on it for another reason. I know we've had some questions before where people have said, is that because nobody's looked at children, they just haven't done the research on children? Well, it's because there haven't been children who've been seriously ill. So there's an absence of children with Down syndrome who've been seriously ill or worse, which I won't say about. There's an absence. There are none. So that's a good sign. Yeah, and if you look at the T21RS, there are some things you would need to be more careful about. Yeah, I've said enough there.
Yeah. So we've got some more comments around GPs charging for letters. I don't think we can say too much about that, but we are aware of that. That's something that we'll be looking at.
Well, perhaps I could just mention, we do have a dialogue with, so there are shielding teams that work in the respective nations, the UK. So we're in contact with Wales, England, and Northern Ireland, and we are feeding back these issues. So we'll certainly take the issue about people being charged for a letter, because I think they would be very keen to know that was happening, and maybe they could clarify that shouldn't be happening.
Brilliant, thank you, Julian. Please can you make available the resource for top tips for triaging individuals with Down syndrome? So direct that one to Stuart.
Yeah, hi. That is actually available for download on our website. If you use the search mechanism, that should come up. If for any reason you couldn't find it, if you just drop us a line using the info email address, and we'll gladly send that to you.
Yeah. We've got Fergus from a local authority. He's wondering how to advise our providers who want to stay open and provide for our people with Down syndrome. So I think I'll pass that one to Julian because I can see him nodding.
Yeah, I mean, it's lovely to have a provider or representative, a local authority involved, very welcome. I think that the key thing is for everybody to understand the status of adults' addition to this clinically extremely vulnerable list. It's not a one size fits all. and it is guidance, not mandatory. So it's not an instruction to, so I think some services have gone into protection mode and have thought, oh, we must now exclude everybody that we know of who has Down syndrome because this advice has come out, and that's clearly not the case. So it's to make it clear to your partners locally that this is guidance, not mandatory, and that it will differ on the individual circumstances of the adult, and that they should try and engage in that dialogue with the family and involving clearly the rights of the individual adult to express their own feelings about this. And, you know, there's been a question that people have asked, should providers be seeking a letter? And, you know, no, there's no requirement for colleges to have a letter from a GP to say that, you know, this individual is permitted to attend college, if you like, or still go to the day centre. So I think it's seeing it in the context within which it was intended to be seen.
Hi, could I just follow that up a bit?
Certainly.
Yeah, sure.
Yes, thank you. I mean, I'm talking particularly about our unregulated providers. So it's not the care that we provide as a council. It's the sort of care we provide via someone else as a council. So the question I sort of wanted to have is, if a provider accepts sorry, this sounds really negative, but if a provider opens to a Downs person with Downs, they're not going to be any liable for any risk, as it were. So we've got everyone obviously all with their risk assessment, COVID secure and all that sort of stuff. So providing we as a council have approved that for a, if I can just say, an atypical COVID sufferer, are people with Downs any more risk from a provider's point of view, or can they address it on an individual risk assessment basis?
I mean, I think, you know, the whole messages around COVID safe environments and all the, you know, hand, space, face, you know, respiratory hygiene, people isolating if they're symptomatic or they've been told to, all those things absolutely apply. And it's just extra important that for adults with Down syndrome, well, for anybody with Down syndrome, particularly adults with Down syndrome, that those things are observed. So there isn't an additional set of recommendations that people are being asked to put in place. I think I'm right in saying that.
Yeah, is Carol? Is Carol?
I am. Yes. Yeah, I'm here. Yes, I think each decision is individual for each person with Down syndrome, and because this is advice, there will be no kind of backlash, if you like, for the provider. It's really the individual with Down syndrome that has to make the choice whether or not to go to the service, and they should be helped to do that by their circle of support and the people around them.
Do you have any examples of good practice, Carol?
Yes, I do. Yeah, there are a few providers around me here in Devon that have worked very hard to make sure that individuals have been able to make those decisions, and the guys with Down syndrome are wearing masks, for example, and making sure that they're all socially distancing from each other and that they're not travelling to their day opportunity by public transport. All the things that that anyone would think about, but they certainly shouldn't be being excluded from day opportunities if they themselves and their families or circles of support have done a risk assessment and deemed that they feel that they're safe to go to their activity.
That's fantastic to hear, Carol. I didn't realise you were in Devon. Thank you very much. I mean, the risk assessments you're talking about is what my team have been doing with the providers. So it's fantastic to hear that that's all sort of filtering through and that people with Downs are at no more or less risk than anyone else. So that's great. Thank you.
Okay.
I think I'd also just say to Carol that same philosophy applies to people attending college and other any kind of if they're an adult, it's kind of down to them to
and work. Yes.
And work, yeah, because we've got lots of comments, and I know the helpline as well has been overwhelmed with questions about returning to college. So we had another question about the online activities, saying that some people will still be at college at 4, which is good to hear. So the online activities that are being launched next week will all be released at 6 p.m. each day, and they will be released live over YouTube, but then people will be able to watch the videos after. So if you can't make the live one, you can watch it at another time, but they also will be on at a time where everyone should hopefully be at home. Okay, we'll just see what other questions we've got here. So good to hear that some people would like to help out. If you'd like to contact us on info@downsyndrome.org.uk, we can help you arrange those activities. It'd be good to have a fitness instructor help us. So, yeah, that's another question about college.
While Robin is just looking for any other questions that we haven't answered, I noticed somebody asked about the status of the date of the 2nd of December. So this is where there are differences according to where you live in the UK. So in England, we're now all in this national lockdown, which lasts up until the 2nd of December. And at that stage, the advice that will be given to anybody that is on the clinically extremely vulnerable list it will be reviewed, and we don't know whether it will change. We hope that it will become less restrictive, so that some of the guidance that is being issued to family individuals about remaining at home and only going out for very limited purposes may be lifted. But that would apply to anybody that is on the clinically extremely vulnerable list. So it's not individual advice to people with Down syndrome or somebody that's got kidney condition. It would be generalist advice that would be to anybody that's on that list.
Thanks, Julian. Another question about what age is classed as an adult. Is it 18? Yes, it is 18 in this case. Lots of the questions have been around college, which I think we've covered there, unless anyone else wanted to ask expand any more on the college situation.
We did have an example through our helpline where the college changed their mind, having been encouraged to do so by calling the helpline. So then the parent queried it, and then college did the right thing, really, rather than making a blanket decision that people couldn't go.
Thanks. I think that answers Sarah's question of where would you start with the college and talking to them. So I'm just going to put a link in for joining Our Voice into the chat, because we've got a couple of people who are asking where they can do that. But yeah, I can't see any other questions outside of college.
Okay, right. Well, I will move on to the next slide, which is we've heard some of the things that we're doing and that we're planning, and we'll continue to offer information, updates and webinars, and we're going to do another one next Friday for 10:30 a.m. and as you did this time, it'll be registering through the shop. Our helpline remains open, and we will continue to advocate for the Down syndrome community. There's a lot that we do that you might not hear about in terms of writing letters and raising the issues that we have and that we know from you that you have. So keep bringing those to us. Thank you very much. I'm now going to play another film from Sam. Thank you, Sam.
I have been on this list since March. And that because of the staying in the house because of the lockdown I've been on. And when I was on lockdown, I have been really busy doing housework, activities, and been walking in the community and going to little shops as possible, but not in the big shops yet. But it's really busy. But if you got any concerns or problems, you can always ring the Down Syndrome Helpline or get advice from a member of the staff from a DSA voice. I had a flu jab done last Saturday, and it will keep me well over the winter.
Thank you very much, Sam, and everybody who has Down syndrome who's joined us, and also the families and practitioners. Thank you very much. Now, I don't know if anybody'd like a last word in our team, or Carol.
just keep watching. We will be doing, as Jill said, we will be doing more webinars, and as we get more information, because this is a changing situation, changing quite rapidly at times, we will keep you all updated, and just need to use common sense, really. And if you are running into problems with, whether it be with your GP, college, employers, anybody, please don't hesitate to contact the Down Syndrome Association, because hopefully we will be able to help you. Thank you very much, everybody.